how to go about it, how shall we learn it. Okay, so guys, this is a cross section of your vocal cord. Okay, so let me see, we'll try what are the namings. So this itself is an OSCE question. Okay, so there's no fun in telling that what is your A. A is your epithelium. Okay, what is B? B is basically your superficial layer, also called as your Rinke's layer. Then what is C? This is your intermediate layer. What is D? D is your deep layer. आसान है, B C D है ना. It is superficial, deep. बीच वाला हो गया intermediate. And then what is E? Which is this muscle? E is which is the vocal muscle, vocalis muscle, whatever you can call it. Okay. And all these B, C, and D totally what they are called as lamina. Okay. So everybody here till like all are okay. किसी को कोई issue तो नहीं है? Okay. So this itself is a question for you guys. And generally this superficial layer, this is called as Rinke space. And this muscle, this is you can call it as vocalis also, or you can call it as thyroarytenoid also. Okay. So coming to your कॉर्डेक्टमी, जिसको अपन ELSS बोलते हैं, यूरोपियन लैरेंजियोलॉजिकल सोसाइटी क्लासिफिकेशन फॉर कॉर्डेक्टमीज. सो टुडे आई टॉक अबाउट द ग्लॉटिक कार्सिनोमास. ELSS, the full form of ELSS is European Laryngeological Society classification of chordectomies for glottic carcinoma. Glottic seal. Okay, so now what happens in the type 1? What happens in type 1? You resect it over here. What we have resected? We have resected the vocal fold epithelium. Resection of vocal fold epithelium. Okay. Now type 2. Now what we will do is, apart from resection of the epithelium, we also go towards the Rinke space and the vocal ligament. Okay. Type 3, just remember this. This is TM. TM matlab transmuscular. So what is the muscle which we are talking about? Vocalis. Now, three में you have removed the muscle. ठीक है, 3 में you have removed the muscle, and 4th में what will happen is total. You will remove whatever is there. So what else you can remove is the entire cord. Resection of cord. कहाँ से कहाँ तक? What are its attachment? Vocal process to anterior commissure. Okay. Now 4 के बाद you will be having 5. 5 में basically what will happen is you will remove major of the things. I'll show you in the diagram per se. What will happen in 5A? आपने उस तरफ का तो हटा दिया. You have removed the total cord. Now this will include, till here you have removed total of the one side. Now अब जब अपना काम, now when your thing is over, you will start disturbing your neighbor or your friend. So what will happen? Resection of the contralateral vocal fold and anterior commissure. 5 extending to 5B. After the vocal fold you remove, what else you can remove? Plus the arytenoids. नीचे वाला हो गया. Now after that even you can extend it further, 5C, 5D. ठीक है. Basically you will go ahead. आपने arytenoid हटा दिया. arytenoid के नीचे क्या आएगा? Subglottis. This also you remove. And 5D, even you can remove the ventricle or the false cords also. So basically you are going one step ahead every time. Okay. And जो 6th वाला है, it is called as anterior commissurectomy. Basically bilateral anterior cords जो है आपके anterior commissure है, that will be removed. So if you close your eyes, just keep this image in the mind. The first one is resection of the fold epithelium. तब जो सबसे ऊपर उसका epithelium है, that you remove. Second में what you are doing is removing the epithelium as well as the rinky space, है ना. 3 you have to remember this line. 3 is 3TM. And how you can remember, we have surgical company, surgical things by the name of 3M. तो उसी से याद कर लो 3TM. Okay, तो transmuscular, you will go through the muscle. Vocalus is removed over here. Then fourth में total everything is removed. Resection of your vocal cord, कहाँ से कहाँ तक, vocal process से anterior commissure तक. 5 will be divided into multiple things. Okay, so what will happen is, till here you have removed total. Now you will go to the next part. Okay, you'll see the same in the image per se. Let's increase it. Okay, so just remember what we just now studied. So in type 1 we are basically resecting the vocal cord epithelium itself, है ना, सिर्फ आपने epithelium हटाया. 2 में you are going towards the superficial epithelium हटा दिया, rinky space आपने हटा दिया. 3TM. Okay, just remember this line, 3TM, that is transmuscular. So over here what you have done is you have removed the entire muscle per se. 4 is total. Okay, so you have removed the entire cord over here, just you can see पूरा हटाया है यहाँ पे. 5 is important. Here you have removed the anterior commissure. Okay, and that too of the opposite, है ना, this is of the opposite part. This you have removed it. और इसमें आपने with 5B में क्या किया, arytenoids आपने हटा दिया. This was the arytenoid which was spared. This you have removed it over here. Same, going deep, it's going into the subglottis, and in the last one is anterior commissure of the bilateral side. Okay, so this was the one thing which I like to start the thing. Now coming to one of the drug based question. The name of the drug is so and so. Please give the mechanism of action and one use. तो mechanism of action मैं आपको लिखता हूँ. Mechanism of action is it basically tyrosine kinase inhibitor. Okay, so what it does is basically it binds to epidermal growth factor receptor. इसको bind करती है and vascular epidermal growth receptor factor को bind करती है. So this is the mechanism of action. You have to write in detail if it comes for the exam. Now can somebody unmute and tell me the use of this in ENT? Try. थायराइड में सबसे ज्यादा क्वेश्चन कहाँ से पूछते हैं, कौन से कार्सिनोमा? पैपिलरी थायराइड का. बट यहाँ पे आपको याद रखना है मेडुलरी है इसका आंसर. ठीक है, this was to make you this mistake. Please remember it. Now don't forget it. ठीक है, both these names are given in your thyroid in your quadrant, है ना. medullary carcinoma of thyroid and papillary carcinoma, please read in detail, है ना. ये individual OSCEs हैं, table viva है, and most of your short case things will go on this and radio RAI इस पे ही जाएगा पूरा. Now 2 side effects are specific for this drug, that is it increases the BP, diarrhea. बाकी remaining तो अपने nausea, vomiting वो तो कहीं भी लग सकते हो, but these two you should remember. Dose 300 milligram. It can happen कि वो यहाँ पे ऐसा कुछ ये कर दे and they might ask you black करके and they will ask you what is the dose of this quantitative. Okay, moving ahead to the next of the drug. The name of this drug is cabozantinib. Dose you can see over here. Mechanism of action and use. See it again. This is a VGF inhibitor. ठीक है. Now again try. What is the use in ENT? Try करो. अरे अभी कौन सा बोला था? मेडुलरी कार्सिनोमा. ठीक है, डोंट फॉरगेट इट, इट इज वेरी इंपॉर्टेंट. तो मेडुलरी में 2 ड्रग्स के नाम दिए हुए हैं इन्होंने, है ना. स्कॉट ब्राउन मेंशन्स बोथ ऑफ दीस नेम्स in your medullary CA thyroid, please remember it. And apart from that, if they ask even one more, so not in Scott, others है RCC, renal carcinoma में, but generally ENT में use नहीं आता, तो you should remember only medullary carcinoma. Okay, now moving to this. Okay, so I'll read and just we will we'll have a little bit of interactive session. A 48-year-old lady came with history of swelling of the anterior part of the neck, which she noticed a month ago. FNAC was done, and this is the IHC staining for calcitonin to be positive. Okay, यहाँ पे क्या देखा? Calcitonin to be positive. Okay, now name any two symptoms associated with this hereditary variety of disease. Can somebody take a try? हाँ बोलो, ट्राई करो. थायराइड में दो सिंड्रोम कौन कौन से होता है? चलो आई लेट यू नो. डॉक्टर स्नेहा रिक्वेस्ट प्लीज आप म्यूट कर लीजिए. थैंक यू. Okay. Second question, name the genetic mutation implicated in the pathogenesis of the above disease. So what is the pathogenic mutation? Let on question. Okay. Name other two IHC markers for the above disease. So they have already mentioned one. The first one क्या mention किया है इन्होंने? Calcitonin. Apart from calcitonin, anything else do you remember? CEA and chromogranin A. ठीक है? You will remember it. Now, last part. What is the targeted biological therapy for this pathology? Now, who will give the answer? अरे अभी तो पढ़ा.
Ventitinib.
Yes. है ना? Keep on speaking. Otherwise, it just gives me the impression that all of you have gone to sleep. और मैं भी सो जाऊंगा फिर. है ना? Please. छोटा छोटा चीज just keep on. Maximum it will be wrong. है ना? So that mistake we'll have to make it here only before 25th. ठीक है? तो answer is ventitinib and spelling एक बार देख लेना. ठीक है? तो this is important. Please remember it. Okay, so just see this once. Okay, this is the scan which is given. Okay, now coming to next section. Now please see the similarity. This is from your Scott Brown. This is from you for your DNB exam, or it's from the direct from the exam slide. ठीक है? So please, that's why I keep on saying, remember the images of Scott Brown. They generally you will get same image or a similar kind of image in your exam. ठीक है? This was 2 sessions back. ठीक है? तो या तो they'll repeat medullary, or if they are getting bored of medullary, so they'll give you papillary. That is the maximum which will be asked to you. है ना? So it's not difficult. You have to just appreciate and just predict what's gonna be asked. Now coming to this, a 6-year-old child presenting with midline cystic swelling as shown in the figure that is moving on deglutition. So we know that this is something to do with thyroid only. Surgical specimen shows yellow tinged thick viscous fluid filled with cyst. Now diagnose the condition. Now what is the answer? Tell me.
Thyroglossal cyst.
है ना? This is thyroglossal cyst. Repeated question है. This is a repeated question. We all know the pathophysiology of thyroglossal cyst. Read it once if you have not read it. Treatment of choice. What's the name of surgery which we do for this?
Cyst trunk operation.
Cyst trunk operation. है ना? So your task for today is read what is removed in cyst trunk operation and what is removed in modified cyst trunk operation. दोनों एक ही पैराग्राफ में दिए हुए हैं. ठीक है? Please read about it. It is important. They have asked you what surgical steps will you take to prevent its recurrence. So you have to tell if you will remove the entire tract with some cuff of tissue around it, some part of base of tongue will be removed, some part of the clavicle will be hyoid bone will be removed. Okay, now just I would like to tell you about something called this Shellang procedure. This is not done nowadays. इसमें क्या करते थे? There was removal of like simple excision of the duct itself. जैसे sebaceous cyst वगैरह हटाते तो पूरा excision of duct कर देते थे और cyst हटा देते थे. No removal of base of tongue, कुछ उसका side वाइड का कुछ नहीं निकालते थे. Now, what is the most common malignancy which can occur? Answer is papillary. How many percent? 1%. So will you remember this thing? ठीक है? It is important. Now over here, please read something about lingual thyroid. ठीक है, कुछ नहीं मिलता है तो मॉर्निंग में when you are using your mobile doing the daily routine activities, just type lingual thyroid on your Google. You'll get 2-3 images. Base of the tongue पे कुछ mass है, you'll see it and what 2 or 3 points just you have to read about it. उतना ही revision है. Okay, so these are the details about thyroglossocyst. Just have a look apart from that. What else question can be asked is this one. Sites of thyroglossocyst and most common कहाँ पे होता है, तो just एक have a look over here. इसके अलावा कुछ नहीं है. Now these are the DDs of midline swelling. ठीक है, we'll just go through it. Now coming to this is very important. Very important. Okay, so if you have not ratified your thyroids and Bethesda till now, you still have 1.5 month, not 1.5, almost 1 month to please remember it. ACR, thyroids, Bethesda, Milan, all three should be learned by heart. है ना, उसमें there should not be any mistake which you will do, because I'll tell you in the exam what the examiner is interested in is, see, we are not, nobody can judge what you have done in the 3 years in just 3 hours of exam. Okay, so what they generally see in the viva is how you will approach the patient. Like suppose you get this case as a short case. So generally what happens in short case, people generally ask is, what is the positive findings of your history, tell me, and how will you manage the case. Okay, so when you say how will you manage the case, so you will have to say ki, sir, I will like to further investigate the problem. Okay, so first test which you will do is thyroid. Now question of viva which comes is, what is the single test if you are allowed to do, कौन सा करेंगे? Answer is TSH. ठीक है, and if you have options available then you can go say everything, sir, T4, T3, TFH, I'll do everything. But if we ask you one test of blood which you will do, it should be TSH. Now after you get TSH, you will do ultrasound of the neck. Now the point is, ultrasound of the neck क्यों करते हैं? Because you get the thyroids reading. और thyroids क्यों important है? Because on it depends whether to do FNAC or not, है ना? Depending upon these are the values. कि किसमें follow up करना है, किसमें FNAC करना है. Normally as a resident what we remember, yeah, like we prefer to operate. So generally we counsel the patient accordingly. You have to get it operated. But if you have to answer in viva, so you have to say, sir, this is the guidelines. So we have to explain to the patient whether to get it done or not. After this, you will do FNAC, जिसमें आपको मिलेगा Bethesda. And in the Bethesda grading, what you get? कि whether what type of cyst is there, what is the percentage of malignancy. This is very important. Why it is important, you should remember it, and because examiner will ask you how will you counsel the patient, so you will say, sir, FNAC का grading supposedly if Bethesda 1 है, so I'll tell him these are the chances of your percentage of malignancy, so advisable to get operated, oblique conservative management, that is followed. So it is not a medical legal procedure, you have to counsel the patient accordingly. Bethesda 2 में इतने percentage malignancy है, Bethesda 3 में इतने percentage malignancy है, and after it should be a combined decision of the surgeon oblique the patient. Okay. And this is very important, even the full form is important, full form of thyroids is important. What do you look over here? 1, 2, 3, 4, 5, these are important, and these are the marks. That 1 में no FNAC, 2 में no FNAC, 3 में you will do FNAC if this is met, 4 में definitely you will do, and 5th में also you will do it. Okay, so moving ahead, there are few other questions same from the thyroid viva session. One is, what is Ebola parotid? This can be an individual OSCE or a spotter type of question. So this is basically the artificial parathormone. Okay, artificial parathormone. Second question, IV calcium gluconate कैसे देते हैं? Where will this be asked? I'll tell you. When if you will reach your viva from your discussion to thyroidectomy. So thyroidectomy में they will ask you what are the complications of thyroidectomy. Okay. और सेकंड क्वेश्चन क्या पूछते हैं कि आफ्टर थायरॉइडेक्टमी व्हाट विल यू वॉच फॉर, व्हाट विल यू लुक फॉर द पेशेंट। आप जब इवनिंग राउंड्स में जाएंगे व्हाट विल यू लुक फॉर द पेशेंट, सो यू हैव टू टेल मी, सर विल आस्क द पेशेंट दैट डू यू हैव एनी पेरिओरल numbness, do you have any tingling around your lips and all. This will tell you whether the patient is landing up into hypocalcemia or not. Okay, and you will do the serum calcium as per your institutional protocol. Somewhere they do it on the evening, somewhere they do it after 24 hours. तो जो भी आप क्या करते हैं you can just say it. Okay, so what are the post-op complications? So you can divide it intra-op, post-op. So this is hypocalcemia. RLN palsy can be transient or permanent. There can be hematoma over here. So calcium gluconate कैसे देते हैं अगर hypocalcemia आ रहा है, तो this is mentioned over here. Please see it once. Okay. Now this is again very important question of the viva. That how will you identify parathyroid gland during the surgery? So this is given point wise. Please have a look. Okay. Still, if you have confusion, do drop me a message. Part explain is a question. Okay. Please read about it. Now again post-op में this is the Shofstack sign, this is the Trousseau sign. Details of this is given over here. How it is done, how it is elicited, what is the grades, how will you manage it, both are important. Okay, so please go through it. It is important. I'll not just bore you up by reading all these things. पढ़ लेना इसको. Important है. You shouldn't leave it. ठीक है? You shouldn't leave it. Both of them are important. Okay. So this is your AGs, AMEs, GAMEs, all those nonsense. For your viva, you should remember the name.
वो पापा क्लास में
Because they tell you the prognostic factor. Your examiner might be just पुराने questions में if he'll ask you what is the prognostic factor of your different staging, you should remember this and the full form. ठीक है? What are the factors which you will take care of it and what are the various staging systems. Just remember the name, that is more than enough. These are the details about RAI.
करने दो, क्या दिक्कत है तुम्हें?
कि वो फोन से उनको ठीक से दिखे ना, इसलिए से समझ ले.
Like basically how to write a theory answer per se, but all the viva points are covered. What are the indications for RAI? What are the advantages, disadvantages? How will you prepare the patient for RAI? This is important. Important. How will you prepare the patient? So just go through it once. What are the indications and contraindications?
पिघलना शुरू हुआ
Okay. Okay. Now this is again a viva question.
पूरे यहाँ तक हुआ करती थी.
नहीं
What is how you prefer hemithyroidectomy or total thyroidectomy? These are the plus and these are the minus. That is the points in favor of total thyroidectomy and the point against total thyroidectomy.
Who is this?
Okay, now again this is an important question.
तो मैं क्या करती थी बाहर वाले रूम में
Guys, 2-3 things are there. Normally you remember the TNM staging of every thing. है ना? So N staging is common for all. Except which cancers can somebody take a try?
सर
तो आपका N या nasopharyngeal carcinoma and
बहुत इन सब ने अली कैंडी नहीं खा रहे.
मेडिलरी
हाँ exactly है ना. So you should remember this TNM for everybody and staging they even ask you in OSCEs also 2 marks के लिए what is the N status. Just रटा पाई है और लिखना है. And but for nasopharyngeal carcinoma and thyroid, this is important. You have to remember it in detail about these two stages. No. What happened in AGCC?
Who is this
they had
thing?
some
What is
of the
this?
changes, major changes. Like we remember when we did the oral cavity session, I told you that they have included something about depth of invasion, which was not there in the earlier part. Now same thing, some similar kind of things, some changes are there in the AGCC 8 for thyroid. Okay, so just have a look. See what they have done over here. They have made some changes. The diagnosis cutoff जो 45 था, they have increased to 55 years. Same for extrathyroid extension, they have increased. Neck nodes का status they have removed, and same they have changes have been made for the anaplastic carcinoma. So good if you have learnt it already. If you have not learnt it, please go through it, है ना? It's just like a small viva point, but you should remember it. Okay. This is like if the examiner asks you, this is a viva question. How will you say that, like when you have taken the history and examination for the patient, how will you find that the patient is having low risk, moderate risk, or high risk? So these are the factors. Please go through it. Now, this is not important. This is basically for the theory part. Now, this is again a viva point, ratta fight. Okay, examiner might give you only 1 minute. I'll give you 1 minute. Just name the signs of your hyperthyroidism. You shouldn't fumble. है ना? फटाफट. What is Stelvak sign? What is Lopez sign? What is Gifford sign? Darlimpus and whatever. No, this is ratta fight. You have 40 days. You shouldn't wake up 2 days before and say कि now I cannot learn it. You still have 40 days. ठीक है? So please remember it. This is my just I'll say humble request, है ना? You shouldn't make silly mistakes. The whole idea is to get more than 50% marks. There should be a level of pass in your practical exams. ठीक है? उसके बाद कितना भी नंबर आपका अच्छा आता है, that's your luck, your everything. My thing is to tell you what is the important thing you shouldn't miss, है ना? You might not be able to answer some of the fancy questions, some of the very recent things which are only given in the journal, some of the things which only examiner knows. That is pretty okay. But if you stumble in these things, what are the signs? What are the signs for hyperthyroidism? This you make mistake. What are the signs of? What are the findings for hypothyroidism? So this is not acceptable, है ना? So these are the primary things which during our residency we daily do. Please go through it. Again, these all are the questions. What are the boundaries of Beer's triangle? Boundaries of Simon's triangle? What is Lowry's triangle? What is Joul's triangle? Triangle of concern, cricothyroid space of leads. Then you will be having hernia classification. Okay, then you'll be having Friedman classification. So please go through it. Okay, this is important. Okay, now both of these law, Simon's law and Wagner's and Grossman hypothesis. I had this similar thing in my FAT exam. Wagner's and Grossman आया था. I was not able to answer. I was literally clueless about it. My question in my FAT exam was, what are the boundaries of Joul's triangle and what is Wagner's and Grossman theory? They might even ask you to draw a diagram of Joul's triangle. Okay? Be ready for this kind of question also. Diagram of this triangle. Not only Joul's. Basically one for RLN, one for SLN. ये important है. Please go through it. Shouldn't be taken aback कि यार ये क्या हो गया. These type of questions are there. Okay. So basically this is the tube you use for your nerve monitoring. Repeated question. Basically RLN के लिए. Remember this bunch of जो red blue this type of wires are generally used ना wiring के लिए. Like that those cheap cables are there. So this looks like that. You can remember it. RLN nerve monitoring. Now over here one question can come of Murphy's eye. What is Murphy's eye? This is present on the side of the tip of your teeth. Okay. Now this is your laser resistant ET tube. What is important over here is you can see this double. You can see this double cuffed. Okay. So this tells you that this is laser resistant. This I have just included because all the signs, these tubes are coming over here. Now coming to two signs which will be there. What is Pemberton sign? This is the sign. This can come as a OSCE, water, and this will be there in your table viva. Okay. So while presenting also you will say, sir, Pemberton sign is negative. अभी आदित्य अभी जो हम लोग 10 मिनट लेंगे एग्जामिनेशन फाइटिंग के लिए I'll tell you. So when you go during the examination of thyroid, तो inspection में this is an inspection sign, inspectory sign, not a palpatory sign. छू नहीं रहे पेशेंट को, we are not touching him. Inspection में you have to say, sir, Pemberton sign is negative, and look at the examiner. I always tell you, art of giving viva is an art. Please practice it. ठीक है? You should give examiner that मौका, that ask me, sir, ask me. I know this. So give a pause of 5 seconds, 10 seconds, not 10 seconds, 5 seconds का रुक जाओ. कि sir, Pemberton sign is negative. And examiner will generally they ask, they build your viva on whatever you say. जैसे आप बोलेंगे Pemberton sign negative तो पूछेगा what is Pemberton sign, how you do it. So just bang on it, है ना? कि sir will ask the patient to raise both his hands with touching both the ears, and if it's normally जो thoracic inlet है, if it is pressed, so this kind of pushing will appear on his face. This is the retroexternal your goiter or the thyroid. Okay. Now again, these both P you have to remember. One is P is Pemberton, दूसरा P is Pizzillo. This is how you inspect the signs in short neck patient by Pizzillo method. ठीक है? You press it like this. Okay. दो और method के नाम है Grimes method and this is Lahey's method.
इसके अंदर की कैंडल
Both are important question. Both are OSCEs,
अलग से भी आती है
spotters, and both are
सस्ते
table
निकलने
viva
की क्योंकि
question.
डब्बा बार बार नहीं खरीद रहे
ठीक है? What is Krayal's method? Demonstrate. They might even ask you to demonstrate it.
उसमें न्यू
अच्छा,
कैंडल
remember
वो खत्म हो जाए
demonstration.
So ये
नेक्स्ट टाइम दूसरा
ठीक है? In your table viva, or if there is a patient sitting over there, they might even ask you, "Hey, Doctor sir, please demonstrate how will you do Lahey's thing." So for demonstration, what is the first important thing you will do? Can somebody take unmute and answer?
आपने ये यहाँ क्या नहीं होता
Sir, you stand behind the
please.
patient.
देख
Okay.
रहा है
Anything else?
ढोलक लग रहा है सही में लग रहा है
Doctor sir, till 25th of February, please remember one thing. Even if you are asked to say anything to the patient, tell to the patient, please remember 3-4 things. One, good morning, good afternoon, namaste, whatever you want to say. I'm Dr. So and so. मेरा एग्जाम है, मैं आपको ये supposedly he says कि do Lahey's, ठीक है? तो मैं आपका गला छूना चाहता हूँ. Whatever language he understands depends upon in what kind of center you are going. Okay, so you can say in English, say in Hindi, at least make an attempt to explain it to him. Take a consent. Okay, please don't touch the patient without consent.
ये कितना गर्म है
This was my motive. ठीक है? Please remember it. Good morning is very important. Consent is very important. And after your examination is over, say thank you to the patient. These 3 points, please don't forget. You all know, yaar. You all know how to do Lahey's. You all know how to do Krayal's. ठीक है? You will put on YouTube. You will get 10 videos on Lahey's. You will get 10 videos on Krayal's. So there is no fun in adding one more thing to it कि नहीं तुम ये हाथ को ऐसे नहीं रखो, ऐसे रखो. ठीक है? वो सब आपने सीखा है. My point is कि to make you not do that mistake जहाँ पे आपको negative marks मिल जाएगा. ठीक है? If you not take consent, believe me, even if you do all these steps right, that fellow is not gonna give you good marks. He might even give you negative marks. ठीक है? चलो let's move ahead. Please don't forget it till 25th of February. You pass your exam, उसके बाद जैसा मन करता है वैसा करो. There are few more instruments by the name of Lahey's. So this is your Lahey's traction forceps. Remember the image? This can come in the instrument section. This is called as Lahey's retractor. इसका नाम क्या है? Can somebody take a try? क्या नाम है इसका?
Jones.
हाँ, Joles. ठीक है. This is Joles. अभी इसके बाद डिंगमैन तुरंत गूगल करना. ठीक है? क्लास के बाद डिंगमैन का फोटो नहीं तो इसका ग्रुप में पड़ा होगा. खोजना उसको. Coaches. ठीक है. This is your coaches forceps. This is your coaches incision. This is coaches test. So all 3-4 coaches are covered at one point only. But he might ask you in thyroidectomy, what else coacher do you know? When you say कि sir will take a incision, so he might ask you what is the name of the incision. So coacher's incision, coacher's forceps, coacher's test. अच्छा, अभी now please be with me for 10 minutes. We'll start with this routine case. 10-15 minutes we will finish it off. That video I have shared to you now, please watch it once or twice. Okay, what all I discussed till now na, this was based on the viva which was taken on that thing. Super specialty viva का जितना points था, I tried to cover in all the points till now. Now I'll try to present it as a, like if it comes to you as a case in your exam, so how you should go about it. Okay, it's not a very big deal. It's a routine thing. Normally, if you fall in the 90% category, you'll get squamous as the long case and thyroid as the short case. Generally, this is the norm. It's because these both things are very common, so you'll get it. And if you are in those lucky part, so you might get it as long course also. So nothing to worry about. You'll get good marks. Okay. So you have to start. What all things you have to cover, I'll just tell you. Sir, 40-year-old female,
सारे पेपर्स
resident
of
Gorakhpur, profession housewife. So I'll keep on stopping in between. So Dr. Saab, why did you ask about the residence? So Dr. Saab, why did you ask about the profession of the patient? So you have to tell, sir, there are certain belts which are known for your goiter. So that this is one thing. Then there are certain occupation with जिसमें कि आपका I'm sorry. There are certain occupations in which your thyroid malignancies are more common. So to enumerate them, iodine deficiency is linked with your follicular carcinoma.
इसमें भी कोई बेटा नाम लिख लेना. हाँ. ओके, ये भी हो गया. हाँ, चलो,
Ionizing radiations.
बस इसका ये
This is linked with
एक मिनट.
papillary carcinoma. ठीक है. So he might ask you what disasters you know. So you can speak about the Chernobyl disasters. अच्छा, in our country, Kerala,
अरे कोई बात नहीं.
the reserves of thorium are very high in this place. Okay, so this can be a question. This was asked to me in Viva. That's why I remember this. Okay, so this is there, and there is no radiation history. Initially, what used to happen? अभी नहीं, मतलब previously, people used radiation even for acne also. Okay, so just remember this point. Okay, now you have to tell about the what is the presenting complaint. Patient came with swelling
तो देखो कौन के
of
पास क्या था. बड़ी
midline
जगह
of
नीचे
neck
लेते हैं, ये ऊपर आना चाहिए, मिटाना पड़ेगा. चलो
of
नेक्स्ट.
6 months duration. Standard history. Initially, this was so and so in size. So what is my opinion is कि don't use that word कि initially it was the size of a pea, now it has become size of a lemon. मतलब this is my personal thing. I never used it and nobody ticked me off till that. So I generally use it this way only. Initially it was 1 into 1 centimeter in size, which has progressed to the present size of so and so, whatever the size is there. Then, sir, the swelling moves on deglutition. Now, this is a question. Swelling moves on deglutition. So, he will ask you, what are the swellings which moves on deglutition, which are the swelling which will move on protrusion of tongue. You should be ready for that answer. Okay, then you will say about negative history. Sir, there is no history of dysphagia, there is no history of dysphonia. You are ruling out other disorders. There is no history of dyspnea. So clinically में आपने क्या rule out कर लिया? So you are ruling out retrosternal poison. He might ask you, why did you ask the history of dysphagia? You will tell sir to rule out retrosternal extension. Then sir, there is no history of pain. There is no history of sudden increase in size. Sir, there is no history of dysphonia or hoarseness of voice. No history of other neck swelling. So what I am ruling out over here? Malignancy. ठीक है? So we are ruling out what is the malignancy. Rule out कर लिया. Then there is no history of hypo or hyperthyroidism. ठीक है? Now again I'll just like to take a break and tell you कि डॉक्टर साहब, normally try speaking as much as possible in front of the examiner. Okay? So if you know that you have enough history and examination present with you, so you can just say कि sir there is no history of hypo or hyperthyroidism and give a pause. Give a pause of 2-3 seconds and let the examiner ask you what are the features of hypothyroidism, what are the features of hyperthyroidism. तुमको ठक 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 करके you just spit it out. Second scenario is if you feel कि यार मेरा हिस्ट्री उतना अच्छे से नहीं है, I'm not having that enough time, 5 minutes का टाइम नहीं बन रहा है. Practice it once before going to the examiner. Okay, don't go in a blinded fashion कि मैं like you have just taken the history and going in front of the examiner directly. No, just try rehearsing it once. Okay, like you rehearse while you go on your stage, you give some performance, you rehearse it outside, just practice it once while going in front of the examiner. Okay, so if you feel कि अभी इतना अच्छे से नहीं बना है, तो यहाँ पे you can include the details here only. Sir, there is no history of weight gain, there is no history of tremors, there is no history of palpitations, no history of hair loss. So with this you can fill in your history. Okay, and other points is like there is no history of hemoptysis, no history of cough, no history of persistent diarrhea. Now why is persistent diarrhea I have included? This is a feature of your medullary carcinoma. ठीक है, given in Scott Brown.
लाइट जलाओ, अंधेरे में दिख रहा है.
ठीक है?
फर्स्ट
Okay.
करना होगा।
Then
कोई गड़बड़ी नहीं।
coming to the past
एक
history,
पेज है, एक पेज का।
there is no history of
अरे, रुक जाओ, मैं कॉपी खोलती हूँ।
prior radiation,
इसको तो सिर्फ रखने के लिए लाया है ना? ऐसे ही रखेंगे।
family history,
बंद करो, बंद करो।
no significant history. So then your viva can go on what are the syndromes, what are the cancers of over here. So इसमें you have to speak about the men syndrome, men 1A, men 2B, वो बोलना है. So please remember it. I'm not going into details of your men 1, 2A, 2B, है ना? So you should be ready about that question. Okay, again without saying familial malignancies में we saw something in oral cavity CA, ataxia telangiectasia, Bloom syndrome, xeroderma pigmentosa, Fanconi's anemia. ठीक है, please remember it. Then if she is a lady, you have to speak about ops / menstrual history. ठीक है, तो he might ask you कि why are you telling the menstrual history, तो you have to tell him कि sir in hyperthyroidism ये changes आते हैं, hypothyroidism में ये changes आते हैं. Then going to the personal history. Personal history में you have to tell whether she is taking salt, adequate iodized salt or not, whether there is history of taking any goitrogen in food और seafood खा रहे कि नहीं खा रहे. ठीक है, these things can be included. Okay, so then he might ask you to summarize the case. So you have to just speak whatever you have told till now, है ना? And you have to say whether it is benign or malignant. So you can use the word probably benign. Normally malignancy is generally not given in thyroid in the viva session. Okay, so you can take the advantage. So probably benign. He might ask you, why did you say benign? You should be ready. Sir, if it had been malignant, would have been pain, there would have been fixity of the skin, there would have been increase in the size, rapid increase in the size, there would have been hoarseness, ऐसा करके है, but it is not the case. Okay. Now, moving ahead on examination.
बैग के साथ देखो क्या?
To start with your routine findings, sir, general condition is fair, BP, so and so, pulse, so and so. ठीक है, so you should remember, है ना, कि BP hyperthyroidism में बढ़ता है कि hypothyroidism में बढ़ता है. Same goes for your pulse, है ना, tachycardia is there in your hypothyroidism. You should remember it. Then your scaling, performance scale. ठीक है, you have to remember this. Full form of ECOG is important. ठीक है, don't forget it. Now, if it is a long case, then पूरा करना है CNS, CVS, respiratory and abdomen. And if it's a short case, तो directly jump to the inspection. So in inspection, what you'll say? See, basically in any swelling, what you have to tell is 3 things. One, when you are seeing the swelling, what are the borders? मतलब